Curve Summit today.
Right. It's setting up right now. Okay, go.
Hi, everybody. It's 4 o'clock, and thank you for coming to our Learning Curve Summit. Today, we have 3 special guests with us. We have Jeanette Vieira, who is with Be Connected Business Solutions, and also the Secretary for the Pismo Beach Chamber of Commerce. Thank you, Jeanette, for being here. She also keeps Valerie and I to task. So I don't know what we would do without Jeanette. And our special guests today are Cristina Martins Sinco, who is an ovarian cancer advocate and educator. And we also have Pam Phelps, who is a 6-year cancer survivor. Yay to you, Pam.
Thank you.
Congratulations on being a survivor. And Jeanette. Oh, and if anybody has any questions, please post those on Facebook, and we'll be happy to ask the ladies as we go through our next 45 minutes together.
All righty. Well, I want to thank both Cristina and Pam for being with us today. What we'd like to just kind of start with is if you could tell us a little bit about your story. So Cristina, if you would like to start.
Sure. So my connection to ovarian cancer is very personal. First of all, I'll start off by telling you that I'm a retired nurse. And mainly in almost 30 years of nursing, I did a lot of women's health and specialty of OBGYN. So I love all things that have to do with women. I believe in educating and empowering women. So that's kind of my professional background. I lost my mom to ovarian cancer 8 years ago. So ovarian cancer became very personal to me. And about 5 years ago, myself and 2 other people who had been touched by ovarian cancer decided that we needed to start a nonprofit in our community to serve the women of the Central Coast. And that's what we did about 5 years ago. That is the Teal Journey Ovarian Cancer Foundation. Jeanette so graciously serves on the board. She was added to our board last year. And I made a connection with Pam, who is also a guest today because of our foundation. And basically that's what we do. Our main mission is to advocate and empower and educate women and men on ovarian cancer, to support women in treatment, their families, survivors, and just let the community know that we're here, and whatever we can do to help, we're here to help you.
Wonderful. And Pam, would you like to share your story with us?
Yes, I'd love to. First, I would like to say that as a survivor in the San Luis Obispo County, until Cristina reached out to me, and I had never met another ovarian cancer survivor in our county. And that was very, very difficult. There wasn't the help or support that's there for some of the other cancers. So I love that Cristina has done that. So my journey, my story starts 6 years ago. I found myself sitting on a toilet, desperately trying to pee 1 drop at a time. I was nervously consulting Dr. Google on my phone while I sat there. My body was telling me that something was wrong, but I had no idea what. I had constant indigestion. It was taking me half an hour to pee 1 drop at a time. And I was borrowing sanitary pads, even though I was well past menopause. I was also noticed that my body shape was changing. I had developed what I called it old lady tummy. All of a sudden I had kind of a poochy tummy, and I'd never had a tummy before. My jeans, I had to go buy new jeans because my jeans didn't fit around the waist anymore. So my toilet time research gave me lots of information on prostate problems. Pretty sure I don't have a prostate. So most of the information I found on the internet was worthless. I did find one site that said that my symptoms could be possibly vaginal cancer. Not a single word about ovarian cancer. I was now officially terrified, and I took the first appointment I could get at my doctor's office. It was with his brand new physician's assistant. She diagnosed me with a benign condition, but at the end of the appointment, my doctor came in to check on, see how things were going because she was so new. And after a short conversation, he said, I think we're going to do a few more tests. So I was sent for a CA-125 and a transvaginal ultrasound. And after the ultrasound, I ended up in the emergency room because now I couldn't pee at all, nothing, and it was quite painful. The CA-125, which is a blood test, came back only slightly elevated. And there are lots of things that can elevate a CA-125 test, so nobody thought I had cancer. The transvaginal ultrasound showed a fairly large mass, but because of the CA-125 and its location, they thought it was a benign fibroid. So I was referred to a local gynecologist who did a uterine biopsy and a pap test, both of which came back negative. And he said, well, I don't think it's anything serious, and my surgery schedule is really full, so we'll be able to do surgery in about 6 months. I can schedule you in about 6 months. I wasn't okay with this. I didn't feel comfortable with it. Something was telling me this is not right. So I sought a second opinion at UCLA. I have lucked out and got an amazing, wonderful gynecologist. And she helped me develop surgery plans A, B, C, D, and E. Plan A was what she thought it was most likely, which would be a laparoscopic surgery, and I'd be in and out in an hour. No big deal. They just removed the benign fibroid. The other letters were for things that might be, but she didn't think it was. Plan E was for cancer, and that plan was do whatever you have to do. We ended up with Plan E. My 1.5 hour outpatient surgery became a 6.5 hour marathon. When preliminary pathology showed that it was cancer, my gynecologist called in the gyno-oncology team. And this is extremely important because it's been shown over and over again statistically that when a gyno-oncologist does an optimal debulking, it increases your chances for long-term survival tremendously. When the doctor came in to tell me that I had ovarian cancer, even though I have a biology background and I know that cancer can occur in any part of the body, my first reaction in my head was, is that really even a thing? I had never heard of ovarian cancer. After my surgery, I experienced a lot of complications and spent a lot of extra time in hospitals, both locally and down south. I had multiple small bowel obstructions, and I also had a stroke, which then required physical therapy. I had a rare type of ovarian cancer, and there was some question as to whether chemotherapy works on it or not, depending on the stage. I wasn't early stage. So I did do 5 cycles of what they call dose-dense chemotherapy, which is basically I received chemotherapy every week for 3 weeks, and then I got a week off, and that was 1 cycle. And then I did that 5 times. So I had a total of 5 months of chemotherapy. During one of my doctor's appointments, I was shocked to learn that my father's family history of prostate and breast cancer on my father's side put me at increased risk for ovarian cancer. I had no idea that it could come down through the father's side. How is this not common knowledge? How are we as women not told this and taught this and to be aware of it? Why do our doctors not ever ask us these questions? That's one of the reasons I've become involved in educating and advocacy. I also received genetic tests. I am BRCA1 and 2 negative. A lot of people only associate the BRCA gene with breast cancer, but it's also associated with ovarian cancer. So, in conclusion, I'm here And I'm here thanks to 42 doctors, countless nurses, 2 physical therapists, a chiropractor, a licensed social worker, numerous nonprofit groups, family, friends, complete strangers, and God. So women, I'd like you to learn the signs and symptoms of ovarian cancer, as well as the risk factors, and listen to your bodies. Thank you.
Oh, Pam. Wow.
That's the short story. I tried to condense it.
Well, I know that we're also very thankful that you're here also, Pam. So thank you for
Yeah.
that.
Yes.
So it's said that ovarian cancer is the deadliest of women's cancer, and it's the 5th leading cause of cancer related to deaths in women. Why is that?
So, and Pam can piggyback as well. The reason being is simple. Pam basically said it, and I've heard her story all across the country with dozens and dozens and hundreds of women. Because ovarian cancer is so hard to diagnose, because there is not a definitive diagnostic tool. Pam mentioned that she had an endometrial biopsy that's typically done for uterine or endometrial cancer. She had a pap smear. We know that that's to check cervical cancer. So there's no way to, definitively check. Researchers are, constantly looking and trying to research a definitive tool. She also mentioned the CA-125 test, and basically with the symptoms, with the intravaginal ultrasound, those are good tools, but there are a lot of false positives with the CA-125. That is a test that basically, after a woman starts chemotherapy for ovarian cancer, they use that blood marker to see if the chemo is working. So as a tool to specifically diagnose the disease, it doesn't work. The symptoms of ovarian cancer mimic dozens and dozens and dozens of conditions, and we've all had them. We've had numerous symptoms: abdominal pain, bloating. I mean, all of us women have had that. Changes in appetite. She mentioned urinary issues. We've all had that. Feeling tired, low energy, the urinary frequency, all of those things. We've had numerous symptoms like that. I think that the most important thing to learn and to remember is if these symptoms persist 2, 3, for more than 2 weeks, get in to see your healthcare provider. And I think that today, what's really important for us to say to everyone who's listening or watching, Pam mentioned it already, is that we need to advocate. We need to be our best healthcare advocate. We need to demand testing. We need to demand a second opinion. And if your healthcare provider is not good with that, then you need to find a new healthcare provider. We know best what is right with our body and what isn't. We're all not doctors or nurses or whatnot, but we know what's right. We know what's normal for us and now what isn't normal. So basically, Jeanette, there is no definitive testing for the disease. The disease symptoms mimic so many other conditions. It's deadly. Most women are diagnosed in late stage of the disease, 70%. A lot of those women have a reoccurrence. Ovarian cancer, there's a very high rate of reoccurrence. And this is why it's so deadly. I mean, Pam is basically almost an anomaly, 6 years out. That's pretty amazing.
Pam, thank God that you listened to yourself in finding a second opinion and not waiting that 6 months.
I'd like to add a little bit to what Cristina said. First, I want to answer your comment. Many years ago, I had a doctor. I'd gone in for a urinary tract infection, and the test came back negative. And he looked at me and he said, in my experience, when women think something's wrong with their bodies, there is. They usually know what's going on. So I'm going to treat you for a urinary tract infection, even though the test is negative. And I never forgot that he said that. And that's part of what gave me the courage when this doctor was going to, put my surgery off for 6 months. I went, no, I'm going to take control of this. This is my life. This is my body. And I'm going to go get a second opinion. So I thank that doctor. Now, one of the other things is I have gotten to know many other survivors. Unfortunately, I have lost close to 50 friends in the last 6 years through ovarian cancer. And one of the things, as far as why it's difficult to detect, is that women are often not listened to. It's very common. I am an anomaly. My doctor listened to me the first time. PA didn't, but the doctor did. I know many women who have gone to 10, 15, 20 doctors saying there's something wrong with me and I can't find it. I have had friends who were kicked out of doctors' offices and told that it was all in their head and that they needed to go see a psychiatrist, not a regular doctor, because they were pushing and saying there's nothing wrong. So the lesson there is that the medical community needs to learn to listen to us as women, and women need to advocate for themselves. They need to stand up and say, no, this is not right, and keep going. I mean, those women that went to 20 different doctors, how many women give up before that? It's crazy. And then the other thing that Cristina touched on is that there is no screening test for ovarian cancer, period. The Pap test does not detect ovarian cancer. And many women, you ask them, do you know anything about ovarian cancer? And they're like, oh, I'm good. I had my Pap test. Mm-hmm. No, you're not good. That isn't it. And the CA-125 not only gives false positives, but false negatives. Mm-hmm. A lot of women have absolutely no rise in their CA-125. So, if you get a CA-125 back up in the thousands, then they go, oh yeah, you might have ovarian cancer. But like with me, mine was only raised a few points above normal, and they assumed it wasn't ovarian cancer because it wasn't high enough. So the CA-125 can give you a clue, but it's not going to give you a definitive diagnosis. The only way to get a diagnosis is surgery and pathology. Wow. Okay. Sorry.
Oh,
no sorries. That's information that we need.
Okay.
Yeah, it's so very important for people to understand this, and not just women, but also, the men, so that they can make sure that they're, keeping their daughters and wives and girlfriends. I mean, it takes all
absolutely
really focus on this and know what we should be looking for. Mm-hmm. So we talked about, why it's so difficult to diagnose. Are there any specific risk factors that somebody might be aware of? I know, Pam, you talked about some health issues that were on your father's side.
Yes. So there can be genetic, factors. If you have breast cancer in your family, that can put you not just at risk for breast cancer, but it can put you at risk for ovarian cancer also. And that's something people don't talk about, which I'm a little shocked that the breast cancer community doesn't talk about that. I think it should be included. They should be linked together. There are environmental factors. Age, somewhat. It is more common in older women, but it is not unheard of in younger women. There are young women, there are children with ovarian cancer. It has, we had 10 women at the retreat I go to that were under age 30. And that was out of 60, 60 women. So, half the camp was under age 30. Mm-hmm. We don't want to limit it by age because of that.
Right. We
don't want to make it more difficult for young women to be diagnosed by saying, oh, it's only an old lady's disease. It's not.
Right. And years ago, that's what a lot of people thought. They thought, well, only, women 65 and plus get ovarian cancer. And that's not necessarily true. Mm-hmm. Another thing, that Pam mentioned stuff, older, as we age, we are subjected to more cancers because of aging, just, being around longer. People are living longer. The genetic mutations like the BRCA1 and 2. There's also a genetic mutation called Lynch syndrome that's also associated with colon. So Pam mentioned breast and ovarian cancer, they're like cousins. And then you throw prostate in there and you throw colon. So that could be either maternal or paternal. When we're looking at genetic testing, I have been genetically tested. My sister has. Now my brother needs to be tested. That means males too, because they can have the gene that they're passing on to their children, correct? So this is what's really important. And we're finding out through genetics, through hereditary studies, that more and more cancers, there's a genetic link between them, whether it be the genotypes, the genes, or something else. There's definitely more and more advancements in that field. And that's why it's so important. So it's important for us to know our family history, both maternal and paternal side. Ask, years ago, many years ago, like our grandmother's age and whatnot, when women or people in general, when they had cancer, they didn't talk about it. It was almost like they were lepers. People thought that if they were around these people, they were going to get cancer, right? So I know as a OBGYN nurse, a lot of people would tell me, well, they weren't sure what kind of cancers they had in their family, that their grandmother died of a female issue. Well, for all we know, that could have been ovarian cancer, it could have been some other kind of cancer. So knowing your family history is so important on both sides. Genetic testing more and more, that's so important. And that's one of our main platforms with the Teal Journey Ovarian Cancer Foundation is genetic testing, because we know there is a linkage between that and ovarian cancer. And that means so much to so many people, when not only is the woman who has the disease being genetically tested, but her offspring. That way we can monitor these people closely. If someone has a specific gene or whatnot, they might need to talk about prophylactic treatment, like surgical treatments and whatnot, as a preventative way of keeping the disease. Again, that doesn't necessarily mean just because you have a mutation or that you have a genetic link that you're actually going to get it, even if you've got the BRCA1 or the BRCA2. That just means that compared to someone who doesn't have it, you're at higher risk. So these are all tools in our arsenal that can help us.
Very interesting.
I'm sorry, like Jeanette, you were asking about risk factors, the family, of course, the genetic. Women who are postmenopausal are more open and to getting ovarian cancer, and of course the decrease in age. Those are all risk factors.
There are also a few others. Obesity, surprisingly, because it increases your estrogen levels, so that puts you at higher risk. Smoking, just general, a lot of general good health things are going to increase your risk.
So I know that we've already kind of touched on the signs and symptoms, but I'd like for us to just kind of go over those very, very clearly, and just some of the things that we really need to be aware of.
Do you want to go, Cristina?
Can you see that?
No, it just looks white.
All right. So abdominal pain, bloating, swelling, changes in your appetite, feeling full after eating very little, urinary symptoms, both frequency and urgency, constipation, pressure in the pelvis, changes in your bowel habits, of course, tiredness, low energy. Those are all symptoms of the disease.
I'd like to add changes in menstruation. If you are young and you're still menstruating, and you either stop having your period or start getting it more frequently, that can be a symptom. If you're postmenopausal like I was, and I suddenly appeared to start having a period again or start menstruating again, that's a symptom. The other one is pain during sex, discomfort. So I think that covered all the ones I have.
And we do have a question on Facebook. So Jill is wondering, women might be wondering, who do they see if they have symptoms? They might wonder if a regular gynecologist could diagnose this disease. Who are the local gynecologist physicians in the area that women can see? Is Dr. Lutman accepting patients?
Okay. Actually, not necessarily just your OBGYN will diagnose you. My mom was diagnosed by her family practice physician because he was diligent in doing lab work and having her have the vaginal probe ultrasound. And that's how she was diagnosed. She also presented herself with, a huge abdomen, what we call ascites, very distended. She looked like she was 7 months pregnant, and that all happened in about 2 weeks. So based on that, him being very thorough, he was pretty sure that that's what was going on. And then the diagnostic tests, of course, confirmed it. So I would start with, because of managed care today, a lot of people have to go through their primary care. So that would be, of course, the place to start. If he or she or a PA or, nurse practitioner or whomever, you're kind of getting the roundabout. And a lot of times women, they go to a gastroenterologist because they have a lot of bowel issues. So they go back and forth and have a colonoscopy and endoscopy, and all of that comes back negative. That's where a lot of time is wasted because these women are, tossed back and forth between all these specialists and nobody thinks ovarian cancer, right? So of course, start with your primary care, whether it be a nurse practitioner, a physician's assistant, a medical doctor, whomever, and then a second opinion. I mean, that's really, really important based on what they say. But yeah, wherever you're being seen right now, of course, that would be your first place. Go ahead.
I'm sorry, I didn't mean to interrupt.
No, that's it.
Okay. I'd just like to add a little bit to that. I agree. My first doctor I saw was a physician's assistant, and then of course my primary care doctor. I was lucky because he immediately thought ovarian cancer, but that's not common. Most of them don't. So whoever you see first, I would ask if you have symptoms that fit this, instead of just accepting blindly the irritable bowel syndrome, which is notorious for people being misdiagnosed with instead of ovarian cancer. Just a simple question. Could it be ovarian cancer? Just maybe help your doctor think. Maybe, could it be? Could it be? Not is it, but could it maybe be? And then if there is any suspicion of ovarian cancer, it's extremely important that you get to a gyno-oncologist, not a regular gynecologist, a gynecological oncologist. It's huge difference in the survival rates. So as soon as there's a suspicion of that, my daughter, shortly after I finished treatment, had symptoms. And we just skipped straight to my gyno-oncologist. I called him up and I said, she's having these symptoms. We don't know, what's going on. And he said, send her in. You do not have to be already diagnosed with cancer to see a gyno-oncologist. Just have the suspicion of it and you can be seen. So I can't stress that enough because it increases, if you are, hopefully not, but if you do have ovarian cancer, it increases your chances of survival tremendously.
That's absolutely true. Seeing a gynecological oncologist does increase, and it gives you better longevity, better quality of life, because this is what they do. They do surgery on women who have ovarian, any kind of GYN cancer. That's what they do. So not only are they, doing the routine in terms of their chemotherapy and whatnot, they're actually the physician who operated on the woman and saw everything right there. And they're following her through her course of treatment during her journey. And I think Jill asked about Dr. Lutman, who is a gynecological oncologist, and he is accepting new patients and he's practicing. His office is actually on James Way in Pismo Beach. That's where his office is, and that's where you can reach him.
Wow.
Yes.
Great information.
Yeah, and it's Christopher Lutman, MD, if anybody is looking for that, and you will find him in Pismo Beach. Thank you, Jill. Let's see. I know we talked about there's really no definitive screening tests. What's the best way? I mean, other than listening to your body, looking for the signs and symptoms, what else can we do?
Well, Oh, sorry, go
Go ahead.
I say, if you're feeling like this is a possibility, you go to your primary care doctor. The protocol for the first steps for diagnosing ovarian cancer are a CA-125, which is a simple blood test, and a transvaginal ultrasound. Sometimes they will do a CT in addition to the transvaginal ultrasound. Most of the time not. I did have it because there were some questions, but usually it's just those two, and that gives you enough information to know whether you want to move forward into a surgery that would give you a definitive diagnosis.
Okay. So, and I know, Cristina, you touched a little bit on genetic testing. How does this help in treatment, and who should be tested?
So basically how it helps in treatment is genetic testing is just the beginning. They're checking to see what mutations, if you have any of the mutations and whatnot and everything else. How it helps then in the treatment is because chemo is not a one-stop shop for people. Depending on what kind of tumor you have, your stage, they do tumor mapping, they do all of these things. That's all with genetic and research and whatnot. 40 years ago, for 40 years, I should say, we've been using the same first line treatment for ovarian cancer. That's how, not advanced it was. We were using the same stuff, even when my mom was being treated 9 years ago, we were using the same stuff we'd been using for 40 years, which that's not very big advancement, especially when you're talking about a rare cancer, because it is rare. That's why when we say that genetic testing is so important, because not only are we checking to see if they have mutations in a genetic link, but then that opens the whole door for, they study the specific tumors, they study, what kind of treatment they're going to do. It opens up the door for clinical trials, because you have to be able to qualify for clinical trials. They're looking at specific, in ovarian cancer, specific women with, this group of age, this age of onset, all of these other things. So I think I'm answering your question. I think that that's probably the most important thing and why we do that.
I would just like to add that it's important to know that there's actually two types of genetic testing.
Mm-hmm.
There's genetic testing for the woman, which is done through blood or saliva. And then there's genetic testing for the tumor itself, where they test the tumor tissue.
Right.
And the two are not necessarily the same, because the tumor can have mutations that the woman doesn't have.
Right.
And that is how they determine treatment, is looking at the tumor genetics.
Mm-hmm.
Okay, that's good to know. So, are there common misconceptions that maybe delay or impact early detection?
Oh, where do we start, Christina? Back to what I said before, is so many doctors don't listen to women. They give them the pat on the head, and you're just being hysterical, honey. You're fine. You're just getting older. Oh, it's just menopause. Oh, it's just that time of your life. A lot of dismissive type behaviors in the medical community, I'm sorry to say. I was lucky, but luck should not have anything to do with diagnosing ovarian cancer. Too many women are unlucky and don't have doctors who actually listen to them and take them seriously. Like I said, IBS, irritable bowel syndrome, so many of the symptoms have to do with our abdomen, and that is the go-to diagnosis for anybody with abdominal problems.
Mm-hmm.
And women are diagnosed with that. Gosh.
I don't think.
Can you add to that, Christina?
I don't think that there's been one woman who I've come into contact with, and I belong to 2 national organizations, that have not told me that they don't even remember how many colonoscopies they had, how many endoscopies. They kept being referred to the gastroenterologist and then back to their primary care. And this went on back and forth for several years. And that is a common fact that we hear all of the time. And I think it just means that these healthcare providers, we need to educate them about the signs and symptoms of ovarian cancer, because that's never talked about. In nursing school, I think there was a whole paragraph dedicated to ovarian cancer in our books. And in all of my years working in women's health, I think I met 3 patients who had ovarian cancer. So it isn't common, but it is deadly. And I think that that's the takeaway from here, that women, we need to advocate for ourselves. We need to demand, not wait for some medical professional to tell us you can go here or there. We need to demand that we have a second opinion, that, you know, we need to speak up. Long gone are the days that we go to the doctor and we just nod our head and just do what everybody is telling us to say. And then we don't even really know why. We're just doing it because they told us to do it. We have to ask questions. You know, we have to, again, be referred to other people. That's why they have specialists. And that's why there's something called a second opinion. And we need to advocate for ourselves. This is, you know, I can't stress that enough. We are educating and trying to educate women. We're also trying to empower them. And we need to take matters into our own hands and just not put up with the degrading, it's in your head, it's, you know, that time of your life, the time of the month, whatever, you know, we know what's happening. We know that there's something not right in our body. And the sooner that these women can get in to see someone, it's just, that has everything to do with longevity, whether they're going to survive, how long they're going to survive, what their quality of life is going to be. Again, because there are no definitive tests to diagnose the disease, and because it's so deadly. And I hate to say it, but like Pam said, she has met and lost so many people that she went to her retreat with. I have met and lost a lot of women who I have gone to conference with and have met in the 9 years that I've been doing advocacy work. I mean, women that were in the prime of their life, women that have young children, women that would have otherwise been well and healthy, but they succumbed to this disease. And like I mentioned before, the reoccurrence rate is really, really high in this disease. There are women that I know that have had ovarian cancer 3 and 4 times. Mm-hmm. So I just think that the women need to advocate. People in general, men, all of us, we all need to advocate better in our healthcare. We need to, you know, speak up for ourselves, be thorough, not leave an exam room with a bunch of questions. If you've done that, your provider hasn't done their job and you haven't done your homework. So we have to be our best healthcare advocate. There's no other way.
Every single survivor that I have met, and I've met quite a few at this point, without doubt, has said, I knew something was wrong with me and no one would listen to me. We know, and we're not being listened to. Now, there's also another program I'm involved in, which is survivors teaching students. And we go into this, the medical schools, and talk to soon-to-be doctors. Some of them are already doctors, but they're in the, you know, what do you call it? The, oh gosh.
Residency.
My brain. Residency, yes, the residency. One of these programs I went to, we had a young doctor come up to us after class, and he said it all so well. He said, we are trained to look for horses, not zebras. And he said, after listening to you, I'm going to be looking for zebras. And I thought that was the best. I felt like I really accomplished something that day. Mm-hmm. Wow. So we need the doctors to look for the zebras.
Mm-hmm. Yep.
So what resources are available within our community for people to either get education or if they need assistance?
Cristina, I think that's all you.
Well, there's the Teal Journey Ovarian Cancer Foundation, of course, and we are specifically, like I said, helping advocate and educate and empower women, and then supporting women in treatment, their families, survivors. There's also the cancer support community that is in Templeton. They basically are an organization that does a lot of support. They do classes and some educational things. It's also free of charge. They have some support groups. There's the Hearst Cancer Resource Center out of French Medical Center. They have a wealth of information there. They also have some classes and support groups. That's in San Luis Obispo. In terms of facilities, there's UCLA SLO, a fairly new facility that's by the airport in San Luis Obispo, and that is just a cancer center. There's Mission Hope Cancer Center in Santa Maria, which is a comprehensive cancer treatment center. And I think I said Dr. Christopher Letman, who is a gynecological oncologist here in our community. There's national organizations.
We lost your audio.
Can you hear me?
Yeah,
Mhm.
I can hear you.
Okay.
I
There are
can't hear Christine. Okay, now I can.
There are national organizations. There's the Ovarian Cancer Research Association. There's the National Ovarian Cancer Coalition. There's the Foundation for Women's Cancers. These are all national organizations that have websites and Facebook pages. They have a lot of downloads. They have awareness. We have awareness cards, the Teal Journey Ovarian Cancer Foundation. Other than our organization as a nonprofit here locally, there isn't another nonprofit that is just geared toward ovarian cancer. Probably as far as probably Thousand Oaks if you go south, and probably San Jose if you go north. We're here to help. We have a website. We have a Facebook page. It's active. We sponsor 2 major events a year, with the exception of this year. Everything is different and strange this year. And we are available to educate groups of people, schools, salons, community centers, wherever. I mean, if somebody wants us to talk and to bring material and whatnot, we'll go. Just tell us where to go and we'll do it free of charge. Yes, we'll talk.
And we just posted the website. It's the tealjourney.org. And that's how you can find that organization. I know you touched upon the Teal Journey. Can you talk a little bit about what the Teal Journey does in regards to support of the community and what they do with the funds that they raise?
Sure. So all of our monies, we're very proud to say that all of our money stays local. It was very important to our board that we keep the money on the Central Coast, because it's the wonderful businesses and supporters on the Central Coast that lets us do what we do. So all of our money stays local. We have given most of our money to Mission Hope Cancer Center in regards to genetic testing. So all ovarian cancer patients now are asked to be genetically tested. Most insurance companies pay for them to be tested, but they don't pay for the counseling. And the testing without the counseling doesn't make a lot of sense. So if there are insurance companies that don't pay for their counseling, we pay for it. We also pay for their offspring to be tested. If their gynecological oncologist or their physician feels that they would benefit from being genetically tested, we will pay for that. We will pay for the actual blood test itself. We'll pay for the counseling, whatever needs to be done. We also have a comfort care bag that we give to every woman on the Central Coast who is diagnosed with ovarian cancer. There's about $250 worth of goodies inside the bag, and none of it is cancer related or materials on cancer, because they get plenty of that from their physicians. So it's fun stuff like a blanket, a teddy bear, some gift cards to local restaurants, a journal, and a candle that was made for us by a local candle shop. Just fun things. We participate in the Day of Hope, which is a day dedicated in the community for cancer awareness in general, and that's through Mission Hope Cancer Center. We've done some educational training. What else, Jeanette? You're part of our group.
We do a fabulous fashion show.
Yes, we do.
You know, and one thing you talked about the comfort bags. So, and just for, I think what I've seen is just the support within the community. It's like I've had people that I've referred. They're like, I have questions. I don't know what to do. Call Cristina. And, you know, Cristina, you are always there to answer questions, to guide people. So I think that's one of the biggest resources that we provide to the community also is just the
Support and connecting. I mean, that's how I connected with Pam. We connected in this way, and Pam has come to our events. She has graciously graced the runway for us as a model, and she's a huge, tremendous advocate. And like she mentioned, you know, Survivors Teaching Students, which is an incredible program through the Ovarian Cancer Research Alliance, and it's a national program. They educate physicians, they educate PAs, nurses, they go to nursing schools. They do all kinds of things, and that's what's really going to make a difference, to educate these medical professionals about ovarian cancer. So when they are triaging their patients and seeing their patients, they'll think, oh yeah, maybe this could be it. So let's talk about this. So every little bit helps. We have to talk about this disease. We have to educate people. We have to do this. I mean, we also do there in the ovarian cancer community, there's something called Teal Tuesday. So every Tuesday we wear teal, and you talk about ovarian cancer. You know, you let people know. And I know in my community, if I'm not called the teal lady, I'm not sure how I feel about that, but people will see me, and if it's Tuesday and I have teal on, they're like, well, yeah, it's Tuesday, you have teal on, you know? So it's a conversation starter. And I think that that's something really important. It's Tuesday. Those of us that are advocates and survivors and supporters, we wear teal, and people that are around us, they know that that's the reason why we're wearing it. And I think that that's something that just strikes up conversation. And because a lot of people don't know, I mean, I don't know how many times people have said ovarian cancer, like, really? Or women who have been diagnosed, and never in a million years did they think that they had ovarian cancer. My mom was convinced she had colon cancer because of her symptoms. You know, other women that I talked to say never in their wildest dreams did they think ovarian cancer. They knew something was very wrong and they possibly had cancer, but they would have never thought ovarian cancer.
That was my reaction. Is that a thing?
Mhm.
You know, ovarian cancer, is that a thing?
Yeah.
It's never heard of it.
And one thing that I did, well, actually I learned a lot, but one of the things that I was surprised about, but also learned through one of the many events and things that I've attended, is even though you've had a hysterectomy and maybe you've had your ovaries removed, you could still get ovarian cancer.
Correct.
Yes.
I don't think that, to me, that was like, how can that happen?
Yeah. Because
It
there's
does reduce your chances, but
Yeah.
it doesn't eliminate them.
right.
Yes.
Because there's still microscopic
Mhm.
particles and whatnot that can be in the, abdominal cavity, and that when regenerated, they regenerate as ovarian cancer. And that could be like with any cancer, really, because there are cancer cells that are not visible to the naked eye. And when physicians are extracting and doing surgery, any of that could be left behind and then regenerate as, ignite as a cancer cell and whatnot. So yeah, of course, it's going to be a lot less if your, tubes and ovaries are removed. And more research is finding that the ovarian cancer doesn't necessarily originate in the ovaries. It originates in the fallopian tubes. It's just fascinating when you think about it, it's wild.
So now, Cristina, I know that you are involved in a lot of organizations on the national level. Through that, are you seeing that they're coming out with, or at least testing, better tools, better treatments? Is there anything on the horizon that is a bright star we can get excited about?
Well, there's a lot of research and a lot being done in immunotherapy, which is really, amazing. Like I mentioned before, there isn't a one-stop shop to chemotherapy. What worked for a woman, two women who are around the same age, diagnosed the same, same stage, whatnot, what works for one may not work for the other. That's kind of where the advancement is in the immunotherapy, using not necessarily just chemotherapy drugs and whatnot, but our immunity and whatnot. And they're learning and researching more and more, about that. There's a lot of advancement as well in oh my gosh, I'm trying to think of
Are you thinking PARP inhibitors?
yes, PARP inhibitors, yes, like Lynparza and those kinds of
Keytruda.
yes, which help. And a lot of the PARP inhibitors with ovarian cancer, first they were mainly used for women who were BRCA positive, and now we know that they also work for women who are non-BRCA positive, and these are another line of medication and whatnot that is working. So they're medications that women take after they finished chemotherapy and whatnot, and it's literally a pill that they're taking kind of as a maintenance dose. Just like women who have breast cancer, they take a medication called tamoxifen for 5 years after they've been treated and had their surgery and whatnot. So we're learning more and more, of this kind of thing, and this is really important. Not every journey is going to be the same. Not everyone is going to have a surgery, taking tumors and whatnot. My mom didn't have any tumors. She never had any surgery. She saw the gynecological oncologist twice, and there was nothing to operate on because it was basically all in the omentum and the cavity, and there was no tumor visible that you could literally take out. So not everyone has tumors. Some women do, some don't. So yeah, I mean, I'd say that immunotherapy, PARP inhibitors, that's kind of what's happening right now. We're finding out that different combinations of chemotherapy works for some women. Again, it's not a one-stop shop for everyone. They're finding more and more chemotherapies that might have been specifically for a certain kind of cancer now is working for another kind of cancer, cancers that are familiar to each other, like prostate and ovarian and that kind of thing. I mean, there's a lot of research being done. So much of it still needs to be done. We're still so far away from a cure for cancer in general, but what we're able to do is people are living longer with cancer and having a better quality of life. And at the end of the day, until we can cure it, or we have prevention. And with ovarian cancer, we know that early detection, we know that saves lives. That's right now, that's our best way of saving lives is early detection, because women who are diagnosed in early stage have 70% more chance of surviving it past 5 years, longevity. I mean, so until we have a cure for all cancers in general, what all of these therapies are doing and all of this research, we're just giving the cancer patient, a better quality of life and feeling better. Longer the days that, people have chemotherapy and treatment and they feel crappy like all the time. There are so many, injections and medication that they can take to help them be able to navigate and live, a better quality of life. And I mean, that's all we can hope for at this point.
I'd just like to add one little thing. One of the things I think it's important for people to understand is that ovarian cancer is not just one disease. There's actually, I'm trying to remember the number off the top of my head, there's 6 or 8 different types of ovarian cancer, and they're very, very different from each other. They present differently, and they respond to the chemotherapies and immunotherapies differently, as well as just each woman's individuality. So treating ovarian cancer, I think of it more as an art than a science almost, because it's, there's so many factors that they have to take into account.
Mm-hmm.
So we did have another question. I think that somebody came on late and she wants to know what is the exam or testing for early detection? So maybe we can answer that just one more time for ladies.
I'd love to answer that. There is no test for ovarian cancer. There is no definitive test. If you are experiencing the symptoms we've talked about, bloating, fatigue, pelvic or abdominal pain, pain during sex, difficulty eating or feeling full quickly, indigestion, gas, nausea, changes in urinary or bowel habits, changes in menstruation, and it lasts for 3 weeks or more, and you need to go in. It would start with a vaginal exam by your doctor, and then the next step would be a CA-125 blood test and a transvaginal ultrasound. But they are not definitive. The only way to definitively diagnose ovarian cancer is with pathology.
Thank you.
Which usually requires surgery.
And then what can we do to help bring awareness in our community?
Talk.
Yeah.
Talk to your friends, talk to your loved ones, other women, men, talk to everybody. Ask them if they know about ovarian cancer. Ask them if they're aware of what the symptoms are. We talk about breast cancer constantly. Ovarian cancer isn't talked about. And I think just person on person talking to each other is probably the most effective way at this point, as well as forums like this.
Absolutely. Yes.
Well, is there anything else that you ladies would like to share, or any information that you would like to give everybody before we close?
I would just, as a closing for me, I would say, listen to your bodies. Women and men need to listen to their bodies, but in the case of ovarian cancer, of course, that would just be women. One of the other things that's important to know is that anyone born with ovaries is at risk for ovarian cancer. And that includes transgender. So anyone who is born female, even if they transition to male, they are still at risk for ovarian cancer. It is also a slightly higher incident in the LBG community, because it's the more times you ovulate, the higher your chances are of ovarian cancer. So if you're not bearing children, your risk is going to go up slightly. I think that's it. I just want people to be aware of it and be willing to ask their doctors, could this be ovarian cancer?
And again, just we know what our bodies, what is right with our bodies, what isn't. We need to be our best healthcare advocate. We need to demand testing. Talk to your friends, your sisters, your aunts, women that talk about ovarian cancer. I mean, it is very rare. This year, probably 22,000 women will be diagnosed with ovarian cancer and 14,000 will die. I mean, those are awful statistics. Yes, it's a small number. 22,000 is tiny compared to women that are going to be diagnosed with breast cancer. But breast cancer is very treatable. Almost 14,000 women will die of this disease. So when you're looking at those figures, I mean, that's daunting. So we need to talk about this disease. We need to educate, the women that we know. Ask for symptom cards, have them in your place of business, promote Teal Tuesday, wear teal, this is why we wear it, blow up Facebook, whatever. I mean, I think that in general, us as women, we belong to a sisterhood. We do all of those sisterhood kinds of things. We support women, not that men don't, but there's something really personal and special about women. So what better way to help support than, bettering their health care, advocating and educating. I don't know what else to say. I mean, that's so important. Autumn agrees. That's my dog.
I thought that was going to be mine.
Well, ladies, that was so informative. Christina and Pam, we just can't thank you enough for taking the time to be on Facebook with us and to inform all these women out there that we do need to advocate for ourselves and we do need to listen to our own bodies. I do want to remind everybody to go to the tealjourney.org. Ladies, thank you again so much.
Thank you so much for giving us a platform to speak.
Yes, thank you.
So I want to remind everybody that on Sundays at 8 o'clock in the morning, we are out there picking up trash every Sunday at the Pier Plaza. This time you will find us parked over by the kids' play zone. So look for a black edge. We have masks, gloves, trash bags, everything you need to help us clean up the beach and our streets. And then stay tuned for the next learning curve on September the 24th. Thank you so much, everybody, and have a great day.